Have I done surgery on a pregnant woman? So two stories with respect to that. One, we had a lady who didn't tell us she was pregnant and came for elective spine surgery, and she was found during the pre-op urine screen to have a positive pregnancy test, and she actually wanted us to do surgery on her, but we declined. She actually said she was getting an abortion anyways and wasn't planning on keeping the baby, but obviously we couldn't take that risk. Spine surgery requires not only anesthesia, but it also requires radiation exposure, which puts the baby at risk. So that's the more minor of the stories there. The more major one is there's a condition called venous sinus thrombosis, where the bridging veins inside the dura, in the dural sinuses outside the brain, can get clotted. That can cause elevation in the intracranial pressure in the brain and can cause swelling and can cause severe neurologic changes. So I have seen that several times over the course of my career, both as a resident and as a neurosurgeon. Most of those kind of cases happen to come on call. You typically radiographically see something called an empty delta sign, which is very classic for the venous flow being abnormal there. And usually when you take these patients to surgery, it's because of a failure a lot of times of endovascular treatments and other treatments such as anticoagulation, but also because the patient is neurologically deteriorating. So in these cases, you do what's called a hemicraniectomy, where you have to take part of the skull out. And one of the cases I will never forget was one where there was so much pressure in the brain that when we took part of the skull out, the brain wouldn't go back in. So the brain was herniated outside, and that patient ended up passing away because of the degree of intracranial pressure. And she was neurologically doing poorly even at the time that we were consulted, so it wasn't a complete surprise. But it's definitely one of those surgeries where you don't forget, because it's two lives in hand at that point.